So actually, I can tell you that we analyzed data of the first 3,000 people who died, and it's quite interesting to know that 20% of them had active cancer, not specifically breast cancer. So it means that on a cluster of patients who died, there is 20% with active cancer. Active, I mean all patients who were under treatment for a cancer in the adjuvant setting or in the metastatic setting. So we have to be very careful to those data, because it means that cancer patients, due to type of treatment they receive, may be more sensitive to the risk of infection of COVID-19. If we look to other data in China, many of the patients with cancer were patients with non-small cell lung cancer or head and neck cancer. So those are patients who received surgery like pneumonectomy or partial pneumonectomy, who are smokers. And most of the lung cancer patients are also affected by cardiovascular disease like hypertension or cardiac ischemia. So my alert actually is on cancer patients, because we expect they are more fragile and they have more risk to have a contact with COVID-19. What's about my cancer center? What we did in Regione Lombardia, that is the epicentrum of all the COVID infection in Italy, is to reorganize the health system, having a spoke hospital for COVID patients and hub hospital for patients with cancer. Actually, we have 2 hub hospitals in Lombardia, and one is my institute, the European Institute of Oncology. The second one is the National Cancer Institute. So it means that if you have a patient that has cancer of first diagnosis and should receive a surgery, the patient will be transferred from the spoke hospital to the hub hospital. And so in the last weeks, we had many new patients coming in our hospital, and sometimes also with some members of the surgical equipe from the other hospital to receive surgery. The same thing for medical oncology patients. So if a new patient should start a neoadjuvant treatment or an adjuvant treatment or a first-line treatment for metastatic disease, is referred to our hospital. Of course, we defined specific priorities. Any case is discussed in a multidisciplinary tumor board, and we defined that some patients have priority with respect to other patients. So one thing is to treat with surgery a tumor that can be cured. Another thing is a locally advanced cancer that can be treated first with radiation therapy, with chemotherapy. So we discuss the general comorbidity of the patients, we discuss the biology of the cancer, and we discuss the probability of being cured with the type of treatment. So it's really complex, because a multidisciplinary tumor board will define priorities according to the evidence that we have and according to the risk of contracting COVID-19 infection. Now, in our hospital, we defined a specific pathway for COVID-free patients. So we have an area of the hospital for COVID positive, because actually we have patients that are COVID positive. They are very limited, 8 patients, but we dedicated an entire area for those patients. All of them are with mild symptoms. All of them received their surgery or were on treatment with chemotherapy. So it means they developed the COVID infection after they received the surgical procedure or a chemotherapy. We try to use personal protective equipment in order to avoid to disseminate the infection to other patients. And there is a dedicated staff that is a nurse staff and medical doctor staff. So it's very important to remember that a dedicated pathway, dedicated rooms are for these patients, and the rest of the hospital we try to maintain COVID-free. So medically speaking, my suggestion is to concentrate resources, expertise, and professional health professionals. So it's very important to understand that the hospital, like is organized before the COVID era, is not the best way to organize it. So define beds, nurse and medical doctors dedicated for a small COVID unit, and then trying to maintain COVID-free the operating rooms and all the common areas. So restrict the access to the hospital to parents or to relatives of the patients, because only the patients should access to the hospital. In terms of suggestion for health professional, use personal protective equipment. It's very important to not contract COVID-19 infection, because if you will be sick as a doctor or a nurse, you will of course contaminate also patients. So use personal protective equipment and consider any patients as potential infected. This is very important. So my suggestion is for public health, finally, you should remember that COVID-19 is a highly infective virus, so start as soon as possible social isolation and containment strategies.